What will I gain from this video? After watching this video, you'll be able to confidently identify the pulmonary veins on PA and lateral chest x-rays. Each lung has two pulmonary veins, the superior and inferior pulmonary veins. These superior pulmonary veins start superiorly and course inferiorly and medially, draining into the superior lateral aspect of the left atrium of the heart. The left atrium is positioned in the thorax within the middle to lower third of the mediastinum. Therefore, the inferior pulmonary veins, which drain the lower portions of the lungs, will course horizontally in order to drain into the left atrium. How do we identify the pulmonary veins on the PA examination? First, we make sure that the patient is properly centered and is not rotated. We then identify the auricle of the left atrium. We can extrapolate from the auricle the approximate position of the left atrium within the heart. We then identify any horizontal structures that are coursing in the direction of the left atrium, and these represent the inferior pulmonary veins. The superior pulmonary veins drain from superior medially and follow a course that's very similar to the arteries and therefore cannot be distinguished separately from the arteries themselves. How to identify the pulmonary veins on the lateral? First, we identify the posterior aspect of the heart. We then divide this contour into two halves. The left atrium lies superiorly and the left ventricle inferiorly. We then look for structures that are extending from inferior and anteriorly entering into this region, and these constitute the inferior pulmonary veins. The superior pulmonary veins, again, are very difficult to identify on the lateral x-ray and will course from anterior and superior posteriorly, and then at the level of the left atrium will extend anteriorly and enter into the atrium itself. So to recap, the pulmonary veins drain into the left atrium. The inferior pulmonary veins course horizontal and are distinct from the vertical arterial branches in the lower lung fields. The superior pulmonary veins have a similar course to the upper lobe pulmonary arteries and cannot be distinguished from them. Here we see the superior pulmonary veins, and here are the pulmonary arteries, and both have a similar direction of flow.